Hello everybody, we're here with Dr. Jeff Audibert. Dr. Audibert is the 1 Minute Healer and founder of Finally Pain-Free, a practice that helps people heal and recover from pain using alternative and complementary practices. Can you give me some examples?
Sure. My first examples were like 18, 19 years ago. I remember being in Maui at a Tony Robbins seminar, and I was on a payphone back in the days where we used payphones. And one lady slammed hers on her hand on a huge metal 12-foot tall door, and she was screaming in pain. So I just hung up the phone, went over to her, did some instant healing that took about 45 seconds, and her pain was immediately gone.
So her hand had been crushed in some big metal door?
He closed the 12-foot tall solid metal doors on her hand. And she was screaming, couldn't hardly move her fingers, and within a minute her pain was gone.
Okay.
That's just one example. There's many, many more. So, about a week and a half ago, two different nurses in the emergency room came to me with a headache. One had a 5 out of 10 headache and wanted some Advil. So just out of a reaction, because I was working in the ER, I gave her 2 Advil. And then I said, well, what am I doing? So I brought her into a separate room. And within a minute, her headache went from a 5 to a half. The next day, another nurse came in, and she just looked distraught. She had taken her Topamax and her medicines for migraines, and she just looked like she was really uncomfortable. So I pulled her into that same room, and within 1 minute, her headache went from a 5 to a half also. And the next day, one of the radiologists brought me his son to take a look at his ear. I took a look inside. It was rip-roaring red. It looked really mean, really angry. It looked like he was really uncomfortable. He just also described his pain as a 5 out of 10. And within 1 minute, his pain was totally gone.
Wow. Is it always that immediate, or do some people take longer, or certain conditions take longer?
Well, like anything else, like when you take a tablet for pneumonia, you have to take a couple tablets a day for 10 days. So like this, sometimes this healing may take repeated sessions, or somebody may walk away from a session and say, well, I didn't feel anything, and then 20 minutes later get home and feel great. I had one friend who saw me about 3 weeks ago. She had the flu. She felt like a Mack truck had run over her. She was very uncomfortable. She had vomited 4 times a day for 1 week. When she left, after 20 minutes, she said she didn't feel any better, didn't feel any different, but she drove home, and several minutes later, her aching and severe pain was totally gone, and she didn't vomit anymore after that either.
Wow, well, that's impressive. That's exciting.
Many people don't know about what I do because in the ER with Western medicine, I can only practice Western medicine. I'm not allowed to do this type of healing in a hospital. Some places in California they can, in Arkansas they don't, and so I do it when I'm not in the hospital. Except for with some of the nurses, they weren't my patients, so I helped them out.